did advise him, though, he needs to probably follow up with his doctor because of blood pressure 165 while you're on while you're on blood pressure meds that's unexcusable, right? That's not, the whole idea is to make sure it's normal.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Marlene Chin, who has been a physical therapist for 20 years and sports fascia stretch specialist. She recently moved to Kingston, Jamaica from Atlanta, Georgia, where she operates the only PT and fascia stretch and fascia training clinic on the island, the Athlete Spa. Her passion is to bring effective new and innovative technology and techniques to help those in the community to recover faster. So Dr. Chin, welcome and glad to have you here.
Thank you. Glad to be here.
Yeah, so let's dive right into it. How did you get interested in physical therapy and fascia stretch?
Oh, geez. They're miles apart from each other. So I was actually a physical therapist. I played sports through high school, and it was between med school and the doctor and PT school. And I was like, yeah, the years kind of made the big difference. But actually, they kind of worked out to be the same because it's 7 years for PT school and obviously 8 years for med school. But anyway, I switched to PT, and I've been doing that ever since. It's the best decision I ever made. Fascia stretch came later. I've been a practicing fascia stretch therapist for about 5 years now. And I was going to a course for continuing ed, and my friend was like, you need to go to this stretch class, you'll like it. I'm like, well, why don't you just teach me? Do I have to go to the class? So she encouraged me to go, and it's been history. I haven't stopped till I finish all the levels that they offer. So it's been amazing.
So what is fascia stretch for people who don't know?
So fascia stretch is more like a rhythmic type of, I'd say it's a blend between massage, yoga, Tai Chi, and stretching, all blended into one. And what we're actually trying to do is to unwind and realign the fascial tissues, which is basically everything that's, it's like, you ever cleaned chicken before, and that thin, filmy thing underneath the chicken? That's what fascia is. And it's throughout our entire bodies. It surrounds our muscles, bones, organs, tendons, nerves, everything. And it also intertwines between everything. And the most important thing is that it's connective. So when you're doing these rhythmic stretch techniques, what we're trying to do is realign and get to deeper layers of the fascia throughout the entire body, head to toe. I don't know if that helps. Yeah.
Well, that's good to know. So what's the biggest benefits of fascia stretch?
I think for me, the biggest benefit that I've seen is the most important is pain relief. It really, really helps to reduce pain. There's other much more benefits. It increase flexibility, increase circulation, helps with improving sleep, posture, all that good stuff. But pain has been the number one seller. Yeah.
Okay. And so how would it be different from your traditional physical therapy? Like, what's the biggest differences between the two?
That's a really good question. I'm going to tell you, to be honest, I very rarely do PT anymore because the outcomes are so fantastic. And I think the physical therapy, we focus on movement, right? Where we're doing, but active movements and strength training, right? So when we deal with muscle, the recovery takes longer. Yes. So because we got to train the muscle, strengthen the muscle, and do all of that because we're thinking from a muscle perspective. But fascia is what covers the muscle. And so if we release the fascia, the muscles get to activate and strengthen much quicker. So the only time I'd say I really do, unless it's a complicated case, like maybe a herniated disc or something like that. But the general person with low back pain, that's the number one thing, right? Low back pain, I will do 3 sessions and it's done. It's done. I always give an exercise program. That's where the PT comes in with me because I know and I understand that just relieving the pain and realigning tissues is not going to be enough for long-term sustainability, right? So we have to implement a strength training program so that we maintain this balance But the biggest thing that I've from incorporating stretch into my PT practice is that the results are much quicker. So something would take me 6 to 8 weeks, twice a week, for 12 sessions would take me literally 6 sessions, literally 6 sessions. So it's a big, big, big difference.
Got it. So for people who are getting PT done on them right now, are you saying that largely fascia stretch will be able to benefit them even more in a much shorter time period, or is it really going to be case by case?
I think it would definitely be case by case, right? Because in the PT clinic, we a lot of it depends on what they're coming in for. For example, let's say you're coming in for post-op, right? Post-surgical care. Yeah, PT is going to be your best move. I wouldn't negate, and I've never worked on, well, that's not true. I haven't dealt with a lot of post-op surgeries other than spinal surgeries, so I couldn't say, but I would bet my life on it that if they were to incorporate some of those fascial stretches in their recovery program, regardless of the diagnosis or the reason they're coming to see them, that it would cut the treatment time down. Certainly, I believe that wholeheartedly. Sciatic, I have a client who had spinal surgery. Yeah, he was pretty bad, and I know, for example, because I used to be a director in an orthopedic hospital, so I know how long it takes to actually recover somebody from a spinal surgery, disc decompression with fusion. Yeah, it's weeks, 12 weeks, 14 weeks, 16 weeks. I think we did about, to be honest, 12 sessions. Now, 12 sessions in total. And he was walking without a cane. Now, he had some botched up surgery. So, but anyway, the point is, I think that any diagnosis you come in there with, if you can do fascial stretch, I guarantee it's going to decrease your time in the clinic.
Got it. Now,
Yeah.
as far as I guess I call it pain threshold in PT, sometimes it can be painful, sometimes it's not so painful. For fascia stretch, how would you compare it from a pain perspective? How painful is it to do it? Is it painful? Is it not? Is it in between? Is it similar to PT?
That's really that's a very good question. The whole objective with fascial stretching is that you should not feel any pain. Zero. The whole treatment, once we the whole treatment should be pain free. Sometimes kind of get into a zone when you're stretching. You may go too far, but that's on the practitioner and not really the technique, right? But the whole entire treatment session is pain free. It's pain free. And that's why a lot of people, like especially elderly people, right? Because they're a little bit apprehensive about pain. And it's in a really calming and relaxing. And that's the whole idea, is to try to take down their neurological system, right? We want to deal more with the sympathetic, keep them at ease, at flow. If you have some good music going on, it helps to lower the anxiety and no pain, zero
Wow.
pain.
Incredible.
Yeah.
So are there certain age groups that this is going to work better for than, like, a certain age group is better for PT, a certain age group is better for fascia stretch, or is it pretty much across the board?
I think across the spectrum. I got teenagers from 14 in sports all the way to an 88-year-old man that I'm seeing. He just wants to walk better. But I think that sometimes you have to be very careful when you're working with the elderly population, right? Because they have, and the tools that you're using, right? So for example, in a case I just had with this 88-year-old man, he does have high blood pressure, which apparently and this is where PT comes in for me, right? So I'm always doing like a blood pressure check before I get started. I'll do a blood pressure check at the end. Yeah. When we started, it was fairly high. Fascial stretch has been linked to lowering blood pressure. Yes. So I wasn't really too concerned. I did advise him, though, he needs to probably follow up with his doctor, because of blood pressure 165 while you're on while you're on blood pressure meds that's unexcusable, right? That's not, the whole idea is to make sure it's normal. But anyway, we did our session, but I had him on a heat pack, and when I had him to help relax the tissue so he's not apprehensive, he can kind of calm down. And when we finished, his blood pressure did not lower. It was kind of the same, if not even a little bit higher, to be honest. Probably he started at 165, he was up to like 168. It was very interesting. So I think that the heat, so we have to just be a little bit more cognizant of age, is what I'm saying, even though you can apply it across the board, but everything is not for everybody, right? So maybe the heat pack, in my opinion, just might have been too much blood flow, going through it.
Got it.
So
And then when it comes to the use of it, is it meant for really anybody? Is it really only meant for athletes, only meant for the elderly? Like, are there certain cases where this can work best? Or again, is it kind of the same thing? Like across the board, it can help just about anybody in any activity.
I think that it can work across the board, any age, any activity levels. I think, and they all, and the great thing about it is that they all feel the difference, right? So all the way across the spectrum, even a little kid can, like, these athletes that I work with from time to time, they can feel the difference in how they move. It's just like the elderly guy when he gets off the table, and I have several, but when they get off the table, they're walking with more pep in their step, more ease. A lot of them ask me, man, am I going to even get taller with this treatment? Because there's a lot of traction involved inside of our techniques, just to create space in the joints. And somebody, am I gonna get taller? So they all definitely feel better than how they came in. Again, the difference is how many treatments is it gonna take to alleviate that pain? So pain is kind of my go-to thing. I want to eliminate pain, right? I believe that we don't have to live in pain, and pain is not a disease of aging either, right? It's because we stop moving, really is what it is. We stop moving the way we used to, and now things are getting tight and matted in our tissues, and it just needs to be released, realigned, and everything to come back into balance. So
Okay. Now, I also do want to talk about your practice. I mean, you're the only game in town, I guess you can say, in Jamaica. So, what is that like? I mean, being the only one of what you do there in Kingston. I mean, is it something that people just aren't very familiar with, and now it's just a matter of educating them, or what is that like being the only one?
and it's been tough. Now I've been here for 5 years come September, so I'm still new. And the first, I don't know, 2.5, 3 years, it's just been educating. When I first year here, I was literally doing free services, 30-minute sessions, just trying to get the word out. I got in with a sports team, a track team out here, free, just donated my services and like, look, let's just do this. He reached out to me, so I thought it was, because they are looking for things that are new and different. At least this coach was, and so and since I started work with them, the kids took off. Like they're right now like the talk of the town in Jamaica. So it was a lot of education at first. And so but now it's like the word is out, the cat's out of the bag. It's it's getting very, very popular because of that's what I'm telling you, that pain. The pain has been the big thing, and people are leaving here pain free without being in pain or going through the process of a painful experience, right? To feel better. So it's been tough, but now it's like it's just taken off. And so we come back to the glory, the sad days in the beginning of trying to educate and push, to now it's like I can't do it all. I really can't. I need help. I need help. And it is a specialized training that I am not allowed to teach per se, right? I can't teach anybody this technique. They would have to go to the training. And I'm in Jamaica. A lot of people don't have visas to travel overseas, so it's just me, bro. And I was just talking about today, like I'm exhausted. I'm tired. I'm super tired. It's been 5 years grinding, just me. The practice is growing. And so I'm kind of like at an impasse, I don't know what I'm gonna do, how I'm gonna get somebody trained. I've had a couple of creative ideas actually.
Mm.
For example, the people that I went to class with, I have now reached out to them and I put out this flyer like, look, I got this thing called Stretch and Play in Jamaica. 2 weeks, come down, you work 4 days a week, 5 patients a day. The rest of the days you go travel the island, go to the beach, go, with a stipend, right, attached to it. So they get paid about $1,800 for 2 weeks. If you can stay longer, fantastic. And a couple of people reached back out to me, so I think I'm onto something.
There you go. There you go. Vacation and work at the same time.
That's right. You can't beat it in Jamaica, though.
Yeah. Now, Dr. Chin, you talked about education, and a lot of it was educating the market in the beginning. So, what's your approach to how you educate your patients on benefits of this specific type of treatment?
I think that, it's kind of like a just almost like I explained to you, and I'm a chatterbox, okay? So they're going to be educated whether they want to or not. So I do talk a lot, and I always let them know, because I know they don't know what it is, and I give that same example about cleaning chicken and that thin filmy stuff you feel, and I just go from there, just like I said. So I'm always educating them on what I'm doing during the technique, try to break it down into what they understand. For example, in fascia, we don't talk about muscles, right? We talk about fascial lines, so if I'm doing a technique and I'm working on the lateral line, I know that they're feeling it more in their glutes and their low back on the sides. So I try to blend the two and educate them like that, but I'm definitely speaking plain terms, just regular language. Now, this is working your glute max. This is working your calves, even though I know that I'm working posterior chain that goes all the way up to the back. And sometimes they'll tell me, wow, I felt that all the way up into my shoulder blades. I'm like, that's my point. It's all connected. And so educate them is easy. Once you start to speak in their terms and not try to talk, above, we don't have to be talking, that type of high level medical terminology, because what you really want them to do is understand and get the buy-in. If they understand what's happening, that the fascia that's over their muscles are dry because of either lack of fluid intake, fluid movement, static positions for too long, overuse, that all of those things damage your fascia. And if we can just release them and balance them out, you'll be good to go.
Got it. Now,
Yeah.
there's a lot of misconceptions that people have about the treatment, or I would imagine in your case, it's more just people have no idea what it is. But I'm sure you also get some people that come in with these misconceptions or these myths that they believe that's just not true. What are some of those common misconceptions or myths that you hear?
To be honest, and I have the luxury because they don't know what it is, so they don't even know that there is any misconceptions. So it's what I tell them, and they believe. I'm sure they can go and research it. Some have, and I've never gotten any bite back about it. And then when they get on the table, it's like, wow, this really is what she said it is. However, you have those naysayers on social media, a lot of you can't train fascia, you can't do this. And so I think that's literally the biggest misconception there is, in my opinion, is that you cannot train fascia. And I think it's because they've never been anywhere to learn that you can train fascia. I mean, fascia is this term that is just coming out, and people are like, fascia, but and it's only being discovered more and more because our technology is getting better and better. Remember, I'm a physical therapist. The only fascia we learned was the thoracolumbar fascia, which is in the back, and the plantar fascia on the bottom of the foot. That's the only time we've ever heard the word fascia ever. And now, because of the technology that they have about looking at fascia, they're learning that it has more sensory receptors than the skin, right? So basically saying that all the things that we feel in our body is probably fascia related first and foremost, right? So that's one of the biggest misconceptions that people have out there, and it really bothers my soul about it. But hey, when you don't know, you just don't know, and you can't get frustrated about it. But I suspect that in the near future coming up, that they're gonna have to change anatomy books, right? Because they're telling us is that the muscle, that's what I've learned, that the muscle moves the bones, but it's really not necessary, right? Because even though fascia is not contractile, it does send electrical impulses for that contractility to occur, if I'm making any sense. Right.
Wow. Okay.
It's
That's very, very interesting. So,
very interesting.
so with this type of treatment, I'm curious, how important do you think creativity and artistry is in this type of treatment? Because I imagine like when people think about PT medicine, it's like, okay, just follow this step by step, do it this way, this way, this way. But it doesn't seem like there's a lot of room for creativity. But anytime I ask medical professionals about it, there's always some level of creativity in there. So what's your personal opinion on the role that creativity plays in the treatments that you provide?
A lot. I think creativity is almost essential. There is a flow, there is an essential flow that you will get the results, right? You just follow that flow, you will get the results. But creativity kind of, and here's the thing, I wish, and I'm not all that creative. I'm going to tell you right now, because I've seen some types of creativity and I wish I could get that. And you have to, when you are very creative with your technique and your styles, you get to access different pieces of the body, right? For I told you, it's all connected. It surrounds and supports everything in our body. So once you can tap in, truly tap into that creative flow, you can start altering kidney problems, right? Lungs, heart, there is a guy out there that is out there doing that now through fascial techniques. I love him. I watch him all the time, where he's helping actually with diseases and organs based on fascial techniques. Now that is amazing. That's truly amazing. He's helping eczema, kidney problems. It's just limitless, and I think it really has to do with creativity and thinking outside of the box a lot. I'll be honest, I'm a new practitioner. I call myself a new practitioner, which I am 5 years in, but that's where I'm trying to get to. So I'm trying different things all the time. And literally the other day, no joke, I had a lady who had diastasis. Basically, there's a separation in the abdominal muscles, right? That middle line. There's a separation in the muscle belly. And so she has issues with bowel movements, those things like that. So we did a regular treatment. I was actually treating her for her shoulders, but I always do a full body because you never know where the issues may lie along the different chains, right? I'm not going to go shoot for the shoulders because it could be something at the ankles. We don't know. And that's the whole thing about looking globally as opposed to, one muscle is causing this problem. Let's go work this muscle to death, right? So anyway, after the treatment, she called me and she says, oh my gosh, I had diarrhea. I was like, diarrhea? Oh my God. I'm like, how was that good? I was very nervous. I was like, why? What happened? She's like, it was no pain. It was no, how when you may be cramping. And she said, no, it just came out explosively. She did it twice for the day and she felt fantastic. She felt fantastic. I'm shocked. Every time I hear stories, I'm literally shocked because, I don't go in with that intention, but I do go in there fully present. Yes. And so you get these different results, and she was having bowel issues.
Wow.
Yeah, it's fantastic. I don't even know what to say. Honestly, I don't even know what to say. I'm amazed every day, every day.
It's an incredible story. I'm sure you have some other ones as far as people coming in really struggling, and then at the end you're able to get them a really, really good outcome. Is there maybe like one or two more stories that you wouldn't mind sharing about situations like that?
Oh man, I have a few. And the one that I can think of the one that means so much to me is an older guy, actually. He's about 70 years old, but he plays golf. He used to play a lot of golf, a lot of golf. He has been having, yes, his spine is kind of messed up. I mean, he has herniated discs all through the lumbar spine. More importantly, he has spinal stenosis, which is basically a narrowing of the canal where all the nerves go. All the nerves. So if the narrowing gets too tight, you're looking at paralysis, both upper and lower body, because it's all of the spinal nerves. So he was concerned. He was scheduled for surgery, actually. And a client of mine referred him to me. She was like, just give her a try. I felt good, And so we worked. He wasn't a believer. I can tell you, he wasn't a believer at first. And he was, but this is going on like 20 years of herniated disc, pinched nerve, and the spinal stenosis. The doctor, here's the best part right here. The doctor wrote a prescription, right, for PT, right? He wrote me a prescription, and it says, look, this guy has been to chiropractic care for how many years? He's done physical therapy for, this amount of time, that it's not even a referral. It was kind of like I don't know what you think you're going to do over here. Anywho, at the end of the referral, he says, and I hope you know that there's no cure. If I could pull that paper out and show it to you. I was shocked because I'm like, is this what doctors are telling their clients? Like, lose all hope. There's no cure. The only way you're going to go is through surgery. So anyway, That was how he came to me. We did 10 sessions, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. When I tell you, oh my God, zero pain, zero pain. That was it. No pain after 10 sessions. And then my thing with PT, this is where my PT comes in, because if you have no pain, then you're good and able to do all the exercises to, like I said, maintain the posture, alignment of the bones, the tissues, and everything. So this will last forever. This is not a quick fix, a scam, right? You're gonna have pain-free for years. It has now been, I think, 12 weeks. I'm trying, because you know how it is. His goal back then was to he wanted to play golf again. That's what he does. All his buddies play golf. So Father's Day just passed. He went and well, actually he didn't get to go, but that's where he was going, to go play golf. I told him, do it. You're ready. Go play golf. Can you believe that? He was scheduled for surgery. I mean, like, he was this close to surgery. It's fantastic. And now with that result, I swear to you, he has sent probably 15 people.
Wow.
15 people.
Wow.
Yeah.
That's one heck of a story.
Oh my God. I can't believe it.
Wow.
I mean, pain-free. I keep asking him every time he comes. So now he comes weekly because he just likes it, and it's a good maintenance for him, because he really feels like if he doesn't come, he's gonna not be good, I guess. I don't know. But he comes every week, and I just keep asking him, how's that pain? And so far, like I said, we're going into about 12, 14 weeks now, and he's still pain-free.
Wow. Incredible.
Yeah. Fantastic.
I mean, where do you think the future of this type of treatment is going?
Oh man, they're doing it in everything. I can't even tell you where this treatment is going, because it's gonna be every facet of medical, even in the medical industry, let's just say. And you could tell where it's starting and where it's gonna go. Okay, so like I said, I used to work in a hospital, big orthopedic hospital. We used to do, the doctors, used to do incisions, big, long incisions. And what they realized is that when they did those big incisions, cutting through the fascia, right? Cutting through the fascia, it would take people longer to recover. Hence, 14 weeks on a back surgery or whatever the case may be. Now, because they are understanding the properties of fascia, they don't want to disturb it too much. This is why they started, this is my belief, based on the teachings from Robert Shelp and all those other gurus of fascia, right, who started this whole thing. They start to do orthoscopic surgery, so the least amount of disturbance to the fascia, and their recoveries are much quicker. And I knew this back in 2007. I was working at an orthopedic hospital, because they used to do the long incisions. Then they started doing orthoscopic towards the end, and the recoveries were much quicker. So that just goes to show, if we can do more minimal invasive types of surgery and damaging and or disturbing the fascia, recoveries are going to be better. As far as athletes are trained, so I am currently I'm doing a pilot program right now on a couple of athletes about fascial training, right? Because what we've understood now from fascia is that it not only is supportive of our organs, tissues, and everything else, muscles, but it's also, like I was telling you earlier, it transfers energy, right? Transfers energy, and more importantly, its properties are vasoelastic. They change depending on the demand you put on it. Some areas are much more tensile and strong. Other areas are more fluid, because that's what the body needs. In sports, you can train your fascia to be more elastic, like a kangaroo, right? Like a kangaroo. You pull back on this rubber band once you know how to train your fascia, and you take off. So can you imagine that without and reducing the risk of injuries if you train the fascia properly, right? So if you're a pitcher and you know how to use your fascial properties, and you get that slingshot back where you're not using muscle energy, right? You're using more fast elastic recoil. now longevity in careers are going to be longer, right? There's no more, oh, you got to come out because of injury. Track and field, the sprinting, it's like you can probably run forever once you master how to use the elastic recoil of your fascia. It's just going to be, I don't know, I can't even imagine where it's going to go. It's crazy.
Sounds incredible. It does. It's a
Yeah,
very, very bright future. So,
absolutely.
so then, Dr. Chin, what's your vision for the athlete spa?
That's and my vision. Oof, my vision is just that, to bring what my real vision is that, because I'm here in Jamaica and we have so many talented athletes, yeah, we have a lot of talent, and the talent you probably haven't heard or seen. They're just some little kids, but there's a lot of talent here in every sport, not just track and field. I mean, they're doing everything. If you haven't seen, I mean, we remember we did bobsled, they got skiing out there. I mean, they're doing race car driving. You're right. So we have a whole lot of talent out here. And my dream is to basically create a high tech, right? High tech training facility. But like I said, more fascial based. So all the training will be fascial based type of training. You can do your skill. It's not a replacement for sports training, because you will have to do your sports specific drills, right, to be better at what you're doing. But I want to have a training facility where I'm teaching all things fascia. Of course, we'll have PT, to make Jamaica the what I call, maybe it's already out there, I don't know, but I want to develop sports tourism. There are a lot of people that want to come to Jamaica to train with and see how our athletes are doing it, how they're doing it. Yeah, I want us to, and they're used to certain things. We don't have all the technology here. So that's what I want to create, a place where international people can come and train and use the things that they used to, plus get some of what we do, sand and beach running and hill running, barefoot, that type of stuff, So that's my dream, just to have to put Jamaica on the map for sports tourism.
Nice.
Yeah.
Now, Dr. Chin, what is the most important piece of advice you can give to someone who is in pain, could really use this treatment, but isn't really sure who to choose? And I know in Jamaica, it's just you, so they won't have another.
They'll have a, but yeah,
In general.
I think that I think they have to be very careful about where they train. I mean, where they go, where they choose, and where. Let's just talk overseas, because, like you said, here it's just me. So this is what they got. But overseas, and I'm not gonna call out any names. Yeah, but you want to look at where they were trained to get their certifications. What level of training, right? So for example, I go to one place, and I've been, because I like to see how other stretch therapists operate, right? So I've been to there's some popular ones out there overseas and in the States. And I went to one, and I was brutalized. If I was brutalized, Lord, it was bad. It was very, very bad. And but I went without any type of research. Let's just say that. Yeah. I went to a second place that also does specifically stretching, and it was fantastic. I actually got the pain. I went there and I really got relief. It was a 30-minute session too. They didn't have an hour for the time slot I needed. But anyway, 30 minutes, and I walked out of there jumping. So I know it works. And my point is this: it depends on where you train. You want to look for different levels. I can speak to stretch to win almost every level from the first to the fourth, because we're at 4 levels in at stretch to win, which is based out in Arizona. And I must put a plug right now. They are absolutely the best school to learn this stuff. I believe. I haven't been to any other, but the family, the camaraderie, the ease in which they teach, and just, making you feel comfortable about what you're doing, it's a phenomenal experience, and hence why I've gone back every year for the last 5 years. I think what they need to look at is where they're training, how long their training is, and some not necessarily background so much, but just where they're training and how long is the training. I think I would want somebody who's doing a week of training per level, yeah, than somebody who's learning a course online for 3 hours. Yeah, that's what I would say. Where are they training and how long is the training session?
Okay, awesome. Now, Dr. Chen, I have one last question for you, but before I ask it, I do want to point people to your website at theathletespa.com.
Yes, yes,
Now,
yes.
my last question is, what does beauty mean to you?
Oh, beauty. I think beauty. That's a good question. It's a sneaky question. I think I'm going to take a moment to pause and really phrase my words properly, so if you don't mind. Um, I think beauty is the ability, right, to be able to live in your skin, confident, yes, confident with you internally, externally, whatever the case may be, but you to be living confident in your skin and doing all the things that you enjoy, yeah, right? Because with that type of energy, you exude a certain type of aura around you, right? And so I think, because I can look at somebody, but like I can tell that they are a beautiful person, a beautiful soul. That's what I think beauty is. Somebody who is in tune with themselves, and in tune with all their emotions.
There you have it, Dr. Chen sharing her expertise. Now, Dr. Chen, where can people contact you and your practice?
Now, I am at 3 Roymar Road in Kingston, Jamaica. My phone number you can reach me at is 876-895-0306. You can dial that on WhatsApp as well. And like you said, my webpage, I'm on Instagram at Athlete Spa JA, also on TikTok and Facebook too. So I'm all over the place.
Okay, well, Dr. Chen, this is a pleasure. Great having you on the show, talking about your message and educating everyone.
Daniel, thank you so much for having me. I appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.